And joining us now to discuss Robert F. Kennedy Jr.'s comments on autism is Shannan Crawford, a psychologist, CEO of Crawford Clinics. So good morning to you, Shannan. Health Secretary Robert F. Kennedy Jr. says environmental factors, not genetics, is behind the spike in autism. What is your analysis?
So there's a model called diathesis stress, which means you have a genetic predisposition, but there has to be an environmental stressor that activates that gene. So it's usually an and, not an or. So what he's saying is you may have a genetic predisposition, but likely there's something in the environment, highly toxic, microbiome, environmental, things that are coming in and now activating that regressive gene.
So Kennedy described autism as an epidemic and a preventable disease. Is that a departure from the broader medical consensus?
When you have rates going from 1 in 150 children in 2 decades, all of a sudden it's 1 in 31 children, that's an epidemic. When I look as a psychologist at families and the heartache and the pain they're going through, and we know that there are factors that are influencing their child's health, I would consider that a very large area of concern for our nation.
Okay, so in your view, could the rise in autism prevalence be due to better diagnostic tools as well and broader criteria? Do you think that that's playing a factor?
So if you level the playing field, our diagnostic materials and assessments are getting better across the board. Autism is the only one having such an exaggerated increase. So while assessment and early intervention is brilliant, and I love it, that does not account for that sharp rise that we're seeing.
Okay, Kennedy says the federal government will be looking into the causes of autism. What would you want to see from this new federal research initiative?
What I don't want to see is people getting political and fighting when really we have children and families that we're seeing at Crawford Clinics and other therapy practices around the nation directly being impacted by this. Rather, I hope it leads to solutions. And there's quantum energy beds like we have at our practice as an integrative practice that we're seeing innovation, that where there's a need now more than ever, let's put money toward research. How do we impact positively? There's light therapy, there's gut microbiome, there's research that does need to be done to help mitigate the impact and hopefully reduce future occurrences of autism.
But do you think the urgency that Kennedy is bringing, that could be a good thing for families?
1000%. Yes, this is the first exhorted effort by our government to actually address something that we're seeing as psychologists on the front lines and the pain of how many families are asking questions and being silenced historically and now being brought to the forefront.
Is there some form of diagnosis in some populations and perhaps underdiagnosis in others?
Oh, absolutely. Autism is a spectrum disorder, so it's along that spectrum. Just like the healing journey, we can bring people to a place of moving toward better diagnosis, more accurate. I think that we are getting more accurate in the diagnosis, and so now we need to know what to do with the prevalence rates of how to mitigate that, and then now how to have early intervention.
So stepping back a little bit, a broader question for you. Many parents are looking for answers about why their child is autistic. How do professionals walk the line between providing support and being truthful and at the same time offering hope as well?
Yeah, brilliant question. So we have to always be bearers of hope. We know that the human will is so impacted by education, by hope, by support. And so at Crawford Clinics, we have an integrative model that we provide the right assessment, it's thorough, and then the interventions are holistic. So providing child therapy, ABA compliant, family support, coaching for parents that are dealing with a child who may be on a neurodivergent spectrum of any kind. And then the innovative approaches, the wellness models of light therapy, of quantum energy field beds, things that are coming out, and there's research of the impact, but it's not getting in the news for some reason. So I'm excited for more families to learn there is hope. There are things we can do to reduce and even improve symptoms.
And another broader question for you. So autism is a medical diagnosis, but in your view, can it also be an identity? Is it an identity for some as well?
I think it can be. I think a lot of people, obviously, I do believe neurodivergent. There is something hardwired within the brain that's going on. But there is a tendency with all physical and mental health conditions to create a label around that. And so I think we need to be very careful of what we would call cognition, or my mental framework, the labeling I create around that, that it's not becoming a stigma, it's not self-limiting, but there's always hope and emergence that even though this is my reality, I am loved, I am valued, but there are things I can do because this is not who I am inherent. This is something that structurally and neurochemically and neurowiring is impacting my functioning. But when I take it out of identity, now there's still a growth mindset, versus if it's identity, this is who I am, it tends to lean to a fixed mindset, which leads to learned helplessness, which leads to depression. So being careful that we don't put identity on something that neurologically can be improved based on the research of epigenetics.
Okay, Shannan, thank you very much for your thoughts today. It was a pleasure having you on today.
Thanks.